Hello and welcome everyone to today's webinar, the role of peer support in Hispanic and Latino recovery communities. Today we are very joyful and feel very fortunate to be joined by our panel members, Carolina Ayala, Anel Hernandez, Gloria McDaniels, and Angelo Lagares. I'll give you a few seconds as all our audience members keep joining in before we begin. My name is Eric Senior. I am the Hispanic and Latino Behavioral Center of Excellence Training and Technical Assistance Specialist and Manager, and I'll be one of the hosts for today.
Eric, if I may just ask people and welcome everyone who's joined us. My name is Anel Hernandez. If I might just ask you to, in the chat, tell us what state you're from or for what city you're logging in from. We'd like to see where you're from. So if in the chat you can put that. No need to put your name because your name will come up.
Thank you. I see everyone keeps joining in. We're very glad. Oh, that chat is very active now. Thank you. That's always wonderful to see. So as we may now move on. So I really want to let everyone know something very important about this webinar, and it's part of our incentive and promotion to disseminate and promote language access. We have full simultaneous translation to Spanish, traducción simultánea español. So to access that, click the interpretation tab on your Zoom panel and click Spanish. So you'll be able to hear today's presentation and today's panel discussion in Spanish. Para aquellos hispanohablantes que deseen escuchar la presentación y la discusión hoy del panel en español, puede ir al botón de interpretación, que es ese círculo como un globo, y luego escoger español. So a few housekeeping items before we begin today. During today's webinar, the event is being recorded and all participants will be muted and cameras turned off. Please make sure your computer's speakers are turned on and up to hear today's presentation. And if you're having any technical issues, please send a message to the Hispanic and Latino Behavioral Health COE on the chat box, which may be also under Vladias. If you have any questions for our presenters, we ask that you use the Q&A tab on the toolbar. You can type in your question and hit send, and we can address those questions to the panelists at the appropriate time during today's presentation or at its conclusion when we'll have a Q&A section. We'll be sharing a copy of today's presentation in PDF format through the chat box. And towards the end of the webinar, please complete the evaluation. Your opinion is really important for us, and a link to the evaluation will be shared through the chat. And you'll also be able to scan the QR code at the end of the presentation to complete it. And we hope to send you a certificate by email from a week to 2 weeks from today. And please remember to check your junk folder. Sometimes it ends up there. About our Hispanic and Latino Behavioral Health Center of Excellence. Our mission is to advance and support the sustainability of behavioral health equity by promoting community-driven, culturally grounded, and person-centered prevention, intervention, multiple pathways of recovery, and recovery support for diverse Hispanic and Latina communities. And the Hispanic and Latino Behavioral Health Center of Excellence recognizes the complexities associated with gender and ethnic identification, as well as the right of all individuals to self-identify. The center uses the term Latine with the intention of both facilitating a fluent reading and pronunciation and supporting an inclusive and respectful language. Latine is a gender-neutral form of the word Latino that uses the letter E at the end, an idea native to Spanish language. And so we are celebrating National Recovery Month now in September. Recovery is as diverse, as unique as the people themselves. There's different beliefs, stories, and paths that can sustain and support recovery. So in celebration of Recovery Month, our center wants to recognize that many ways Latina individuals, families, and communities understand, live, and experience recovery. And also beginning September 15th, we started celebrating Hispanic Heritage Month until October 15th, recognizing the contributions, the significant contributions of the Hispanic and Latino behavioral health workforce. That includes counselors, social workers, peer recovery support specialists, promotoras, and the communities they form part of. Through their shared vision and voices, we are helping shape multiple pathways of healing for a more equitable future for all. So thank you for joining us today in celebration of both National Recovery Month and Hispanic Heritage Month. And now I would like to welcome today's panel members, and I'll hand that over to them so they may begin their introduction. So thank you. We are very grateful for having you, and looking forward to today's discussion. Yes, we will begin. You may wish to introduce yourself.
Sí, buenas tardes. Thank you so much, everybody, for being here. My name is Angelo Lagares. I'm a person with long-term recovery. And what that means for me that March 22 of 2005, I made the decision to go into this path of recovery. After 40 times in treatment, in another treatment, I spent my whole life in another treatment. I'm Dominican from New York, born in New York and raised in the Dominican Republic. So much.
I am a licensed addiction counselor, licensed professional counselor, and peer recovery coach. I am originally from New York, so I am a New Yorican. I've been in recovery for 32 years. My healing journey includes religious and spirituality as I was healed from my addiction. I'm a living miracle. I moved to Colorado in 2010 and began my professional career in 2011, attending Metro State and graduating in 2013 and Denver Seminary and graduating in 2018. I am a survivor of domestic violence, sexual assault, and child abuse and neglect. And I started Crisalida as it's a place where Hispanic Latina community can find healing and receive services via case management, counseling, and peer recovery coaching.
Hi, thank you, everybody. My name is Carolina Ayala, and I am a first-generation American born in California with roots in both Indigenous and Spanish heritage. Having grown up in Texas, California, and Mexico, I carry a lot of richness with diverse background with me in everything that I do. I am a woman committed to long-term recovery. My recovery date is February 18th, 2021. I'm also the founder and executive director of the Happier Life Project in the Inland Empire, which is Southern California. To me, what this means in recovery is embracing a lifelong journey of growth, healing, and self-discovery. It's about honoring my past while building a future rooted in resilience, self-compassion, and cultural pride. Thank you.
Buenas tardes. My name is Janer Hernandez, and I have the privilege of being on this panel with these three other great people from all over the country. I am from Puerto Rico, and I live in Massachusetts. I worked in the field of health and human services for the last 36 and a half years. I am chief of public health at a local community not-for-profit based organization in Springfield, Massachusetts, known for our work in leading with equity. And that organization is the New North Citizens Council. In addition to that, I'm on the steering committee of the Peer Recovery Center of Excellence. I'm on the steering committee with the National Hispanic and Latino Center of Excellence that's hosting this here today. And I am also a person in long-term recovery, which for me means a number of things. That enables that I haven't used drugs in the last 37 and a half years. My anniversary date will come up on December 20th. And that enables me to be a productive member of my familia, my community, and to be present here today. It also enables me to never have to be a victim of mass incarceration, because this country leads with incarcerating people with mental health and substance use issues. So I'm really happy to be here, and I look forward to our dialogue with you. Thank you for putting all of your states and locations in the chat, from California all the way to the East Coast of New York, from all the way up north in Maine to the point of Florida and everything in between. Thank you for doing that, because it shows our diversity, where we're joining from, and all of that other good stuff. Muchas gracias.
Thank you. Muchas gracias for those introductions. Now this time I think we can start moving on to part of our discussion around some areas that we want to emphasize in terms of the visibility and also the significance that peer recovery and its role has for Hispanic and Latina communities. So beginning in this area, first want to address peer support and the recovery journey in terms of Hispanic and Latina communities. So we want to begin with this first question. In your experience, what specific aspects of Hispanic and Latina culture have been most valuable in providing peer support and as part of the recovery journey?
So I want to start by saying there's a few key points that have been most valuable in providing peer recovery support. The first one is cultural relatability, right? Sharing personal stories within the community fosters trust and connection. When individuals can see someone who shares their backgrounds and understands their unique challenges, it can encourage them to open up and seek help, right? Another point is community orientation. That's the importance of family and community in the Hispanic and Latinx cultures, where we can be a strong support system for one another. Encouraging involvement from family members and friends can create a more comprehensive network of support, reinforcing the idea that healing is a communal effort. Language accessibility, right? Language plays a critical role in making services more accessible. Being able to communicate in Spanish not only helps break down barriers, but also ensures that individuals fully understand and support being offered, the support being offered. Cultural sensitivity is another one. Education about the healing process that represents cultural values and beliefs can make recovery feel more relevant and accessible. Tailoring approaches to incorporate cultural traditions and practices can foster a greater sense of belonging and acceptance. Another one is empowerment through storytelling. Sharing personal recovery journeys not only empowers the storyteller, but also inspires others. It highlights resilience and the possibility of healing, making the journey feel attainable.
Lori, thank you so much for that full response to this question. And I heard a lot of great not only concepts, but insights into what it can mean for Hispanic and Latina communities. You mentioned healing, you mentioned storytelling, you mentioned inspiring through shared backgrounds, right? And how we may narrate a shared story to those we feel we can connect to. And it seems like that's a central, one of the central roles that peer communities have for Latina communities. So thank you for sharing that. And before moving on to the next question, if there's any other panelists who might want to address any aspect of this, Carolina? Yes.
Hi, thank you so much. Thank you, Gloria, for that. For me, being newer on the recovery journey, what was really important for me was the strong family ties familismo, this time really connecting with the familia, having them be a part of my healing process, their education on what was actually happening with me. This wasn't the first time of an attempt at recovery. That was really, really important, as well as there was spaces that I knew that already existed where a lot of people collectively came, but maybe I didn't feel that I fully fit in, but that was the place that I started. And then that gave me the opportunity to then reach into cultural practices, ceremonies that are part of my roots. And I was able to connect back with that. And I think that was very important, something that has helped with my peer support journey. Also being a peer support, being able to do that in Espanol was very important to the people that I serve. So that was very helpful. And that's just what I've seen in my own recovery journey, is getting rooted in my spirituality, my cultural practices, my ceremonies, and that has helped me. So just wanted to share that. Thank you.
I'd like to share a little bit here, Eric and others, and thank you, Carolina and Glory, for starting us off there. I went from prison to treatment, not because I wanted treatment, but because I wanted to get out of prison. I was fortunate enough that the place where I landed was a residential treatment facility in Boston, Massachusetts, called Casa Don Pedro Albizu Campos. And so I come from the street, I come from the prison culture, I come from drug using culture and that sort of thing. And I entered into a place where there were other 39 Latino males in treatment, and all of the staff were Latino males providing the treatment. And there were many important aspects of culture there, including the food, the music, the language, all of that stuff. But I want to drill down on something very important. They taught me what it means to be a Latino male, and not from that perspective of toxic culture of not expressing feelings, not be able to express emotions, not embracing other men and listening to stories with intent and that sort of thing. And they taught me a great deal of what it means to be a responsible Latino male in society, right? And so for me, that aspect of culture is really huge. In our system, in our field, people say, oh, son machista, they're all machista. Not all of us, we have incorporated that because we've been taught ways of thinking and doing that are grounded in that male chauvinist behavior. But people can learn other ways of doing things. And I am forever grateful for them, because they started my journey of learning, or I started my journey of learning through their practice and through their examples and how they embraced me and other people. And so it was in that place that I was able to dismantle some of my toxic thinking about who we are. Not all aspects of machismo are bad, because to be a caregiver, to be a provider for the family is not a bad thing, right? But those cultural aspects were really important for me, and how we view females in society as well. So it's a huge learning from peers in that environment that helped to inform who I am today.
Thank you, Hunter, and thank you, Carolina. Thank you, Glory, for bringing that in. And I think, going back to what was last said by Hunter, there's cultural domains and cultural norms that resonate, even gender norms that look different for Hispanic and Latinos, and that's important to be recognized within the settings of peer recovery and the recovery journey. So thank you for highlighting that. I think now we can move on to our next question, where we want to address a bit about cultural barriers, such as stigma, as one of them. So this question would read, what are some commonly held beliefs about addictions, substance use, and recovery that you've encountered in Hispanic and Latina communities, and how do you address this peer support roles?
Sí, buenas tardes, otra vez. Good afternoon again. When we talk about stigma, we can say that stigma ha sido una maldición en el siglo XX y XXI. It's been a curse in mental health and addiction. Government say that, the opposite of addiction is connection. And it's impossible to get that connection where we have. And when we talk about stigma in our culture, how it affect us, when we say, that strong word, that those system of belief that we grew up, like tecato, those words like drug addict, all those terminology that we use in the 70s and the 80s. Why was that in our culture? Because we didn't have no education. We didn't know better about about language and recovery and what that means. We didn't have the conversation. And when we talk about stigma, it's like oppression. It's really important to understand that stigma is it's a cultural barrier, but es perpetuada, ¿cómo se dice esa palabra? Because it's a systemic barrier, because if we don't have no education, if we don't have no support, for example, 60 million people in the United States, how many peer support training do we have? The lack of education, the lack of training, the lack of information, it's gonna, how do I say? It's gonna continue these disparities, and we talk about, we come from a culture and those system of belief that my grandmother and our family in big denial. In the case of my family, mental health and substance use was huge. Like 5 people went to prison. Like 15 cousins, had problematic drug use, but it was always a big denial. In my family. In what is important, what Glory and Hannah and Carolina were saying, that todo tiene la cultura, everything is in the culture, because culture, without culture, healing, how healing is going to happen? And when we address stigma and we talk about peer support, specifically in the Latino culture, it's important, the conversation. Thank you so much.
Thank you, Ahmed, for that. And some of the things I'm hearing, that you started mentioning the connection as one very important point, right? And I feel that you were also mentioning around that connection means moving towards conversation, opening up conversations that weren't there. In the absence of the conversation, stigma can arise, right? So there's an aspect of literacy, there's an aspect of beginning to address areas where we create barriers to access care when we don't begin to speak about it. Before we move on to the next topic, I want to make sure I give a chance to any other panelist members who may want to address one point or another around this question.
I would like to include the skepticism about professional help, right? There's so many of us Hispanic, Latinx community members that we fear seeking help from a professional, right? And finding treatment somewhere. So finding a place where we can share in our own language and normalize conversations, and a place where we receive education and we can raise awareness to engage family members is so needed within all of our communities. Also, the religious aspect of it, right? Sometimes religion means you didn't have faith enough, right? For some people. And how do we break down those barriers of saying it's not a matter of faith, it's a matter of support, it's a matter of education, it's a matter of bringing in the assistance I need so that I can journey towards my healing.
Thank you for mentioning that, Gloria. And as you all mentioned, all of your insights. I feel that all of those connections, all of that areas to address in conversation have to be within a setting that feels safe for us to connect. And sometimes culture can be for us that safe setting. Carolina.
Hi, thank you. I want to highlight how the question says, commonly held beliefs about addiction, substance use, and recovery. And growing up in a family where that wasn't even words that were used, right? The borracho was just the borracho, right? It was normal. So even to get to that part of what is addiction, what is substance use, what is recovery, that didn't even exist. Like if you couldn't hang for those 3 days, 4 days of the parranda, like something was wrong with you, right? It was just normal to do. Even just that education of what that actually looks like, or when you are the person that when the party is over and everybody's ready to go home and you're like, no, I want to keep going. Like that's there's trouble there. There's issues, and who do you talk to about this, right? Like it's not a common theme. It almost seemed like a sign of strength to be able to drink more and to just be able to, I remember when I was really, really young, having those big parties and having everybody with alcohol and being able to just drink everybody under the table. Like that was a sense of pride. And that was what gave you value in a lot of the spaces that I was in. So that was something that was not known. I grew up with grandpa that always sat on the porch drinking his alcohol. Mom, stepdad, and then when mom stopped drinking, because she just stopped, that was a big thing. Like, what was wrong with Carolina, right? That she couldn't just stop. And my mom used to say, something's wrong with your mind. Something's wrong with your mind. And that didn't mean go get some mental help. It just meant you're crazy, right? Like something is dysfunctional about you. And internalizing that within this cultura, it's like it's a big thing. And I hear that a lot with people that we support also, of like, where do they go to these spaces and places to be able to talk about this, and where it's not the secret that you're letting out about the family. That's another big thing.
I'd like to add something here as well. And first, let me say that I said people from across the country. There are people here from the U.S. Virgin Islands and Puerto Rico as well. And so it's not just folks from within the States. So I wanted to give a shout out to those folks as well. I want to just say a few words about how do we address these in peer support roles, right? Because the rest of the panel members have done a really good job of couching this in cultural beliefs and that sort of thing. So when you heard us introduce ourselves earlier today, we didn't say, I'm Hanet and I'm an addict. We didn't talk about substance abusers. We didn't do any of that, right? We couched this in language that is strength-based language. And so within the peer support role, that's what we're called to do, right? To do away with substance abuser, with schizophrenic, with homeless, with describing people by a disease, because we're not that. We are human beings, right? And so we're called, as folks who work in the peer space, to humanize people. And how do we do that? That is a person experiencing homelessness. That is a person with a substance use issue. That is a person with a mental health condition. We are called upon to use our lived and living experiences to tell a story, right? Peers are called upon to use that experience to help other people relate to what they're going through. And so that those people begin to understand that we too have some level of empathy and understanding, not with that we understand it all together, right? Angelo and I are two Latino males in this room. Angelo's from New York, Dominican Republic, yo, Massachusetts, Puerto Riqueño. And so, yes, we have a lot of similarities, but there's a lot of nuances there, right? And so in how we address this in the peer support role is also to validate people's experiences and to hold them up, and again, to humanize people and to listen to people. That program that I was telling you about, the first thing that they taught me is that they believed in me more than what I believed in myself. That is a huge gift, right? That is what Carl Rogers calls unconditional positive regard. Well, guess what? In our communities, the people with the most expertise in believing in us more than what we believe in ourselves are women, are females. Doesn't mean that men cannot do it, but that's what we're called upon to do. How do we take these cultural elements, right, put them into practice, humanizing people so that people want to come back, They say, no, yo quiero ir a donde Carolina, right? I want to go to Carolina because she just said something that connects with me, as opposed to, you know, this wall of I don't share anything about myself because these people can't be trusted and they're going to use it against me. In the clinical world, that has been the mantra. In our world, that mantra doesn't work because we are about engagement and connection.
Thank you again for those responses, and thank you for making it very visual, even visually. I can see the story in very concrete as to when we're trying to move toward connection, what may happen in the way. So now I want to make sure we get to another set of questions that around the significance of this roles in peer recovery. Relating to culturally relevant peer recovery models, what culturally tailored strategies have you seen work best with engaging Hispanic and Latino individuals as peer support in recovery processes?
Hi, I'll go ahead and take this one. Thank you. So being in California, being in the peer support, peer recovery models, being the 49th state to bring peer support within a medical model, I guess, is a clinical model out here in California when it is peer. We had not had any trainings in Espanol, right, for about 3 years. Everything was in English. So in that, what I have seen that has helped the Hispanic community, Latino community, Spanish-speaking community, is roles like community health workers, roles like promotoras, the community themselves that look like me, speak like me, and having that shared community within the recovery process. And one of the things that we've been able to do out here is then, and this kind of tails back on the last question, is being able to then work with the community health workers and the promotoras and have education and training to them in Espanol about substance use. And coming from people that are in recovery, that were those people that they're working with on a daily basis out in the community. And the impact that that has had is, I just look forward to doing more of that, because they may not be in recovery themselves, but they have this different idea, this different stigma, the different cultural understanding, and then seeing people in that recovery journey, being able to come back and deliver what that process looks like. Is very impactful, and that's what I've seen so far out here in Southern California that is working well. And I'm happy to say that we will now be having training in Espanol for peer recovery support specialists.
Thank you, Carolina. So culturally responsive and culturally linguistic appropriate services are one of those very critical strategies to engaging Hispanic Latina individuals. Before we move on. Yeah, Angel, yes, please.
Okay, thank you so much, Carolina. And when we talk about tailored strategy, right? The importance of cultural elements in public health in general. But when we're talking about any engaging in any system of recovery, we talk about harm reduction, from overdose prevention, non-crime training, peer support, RAP, everything has to be centered in the culture. Not only when we talk about, the Latino culture, but any culture, when we talk about language, custom, tradition, value, religion, language, symbols, norms, to create a system that works for a human being, you have to understand, when we talk about person-centered, right? When we talk about person-centered, that person, how we pray, how we eat, how we dance, we have to adapt. And that's something that has been missing in the last 50 years in public health. It's completely missing. And that's, I'm working with Carolina and always Barry and Hanel, well, this understanding of how we're going to present there that to be able to engage a peer support, we have to change like the whole curriculum, right? And it's perfect. Like, I went to treatment like 40 years ago, 30 years ago, and there they have like the music, La Roca con Habichuela, and that heals him, because when he went to that treatment, like I went to Alcrea, like in other century. When I went to Hogar, that love, that love in the meal, in all those cultural elements is really important in public health. That's why we have to continue to promote, that culture is essential for healing. Thank you so much.
Eric, I'd like to add something here. One of the first things that we encourage people to do is to understand when we say Hispanic, Latino, Latina communities, who is it that we're talking about? Because that's a huge umbrella, right? And there's a lot of diversity within our folk. And so we need to first understand who we're talking about, right? The community looks different depending on what region of the world, what region of the country, what region of the state, what municipality. It just looks different based on that. And many service providers do not leave their offices. There's an assumption that all of these people speak Spanish. Wrong assumption. Yes, some of us speak Spanish, but some speak English and others speak Portuguese and others speak other dialects, including indigenous languages and all of those things that we've been talking about here. So to understand diversity means to get out of our comfort zone, right? And to be out in the community and to learn who's there, not just who the majority is, right? I live in the Northeast. Here in Massachusetts, the majority of the Hispanic Latin population are Puerto Rican. That doesn't mean that everybody here is Puerto Rican, right? It doesn't mean that. So I need to first understand what that is. And then I would push us to push ourselves and think about when we say adopting and tailoring a curriculum or whatever that thing is, that usually comes from, it was developed in English and we need to adopt and tailor it to our community. And we need to break outside of that mold and say, no, some things we need to develop. Never mind the translation. If someone wants to do a translation to another language, but we need to develop it in our own language, centering la cultura. ¿Verdad? Carolina and Angela were talking about that, right? So how do we center that as the primary vehicle for reaching and engaging people, right? And those aspects are complex. They take time, but they have greater potential to reach and engage and retain our people in processes related to recovery. I would be remiss if I mentioned that according to SAMHSA, there's 23 million people who identify as being in recovery in the US. There's an additional 44 million people who identify as being in recovery from a mental health disorder. That's millions and millions of people, millions and millions of families, and our folks are represented within those spaces and places. We are not saying here, right, and through our work, that you need to be Hispanic or Latino, Latina to serve our folk. We are saying is that we all need to understand our folk better, including those of us who are Latino, because it's not a given that because I identify as Puerto Rican and Latino that I know everything there is to know about my own culture, never mind everybody else's, right? So it's that specific look inward in terms of who we are, what we bring, and what we contribute to this process that always engages me in thinking about how do we develop things for our communities, with our communities, as opposed to this adaptation and tailoring that comes from some process that was taking place somewhere else.
Thank you for that. Those powerful messages, I think very resonant messages, and also in the line of how we create meaning together, right? And going back to communal healing, it has to be in a place and through a process where the experience is at the center. And we've sometimes talked about lived experience, but we also experience growth, joy. We also experience all these aspects of purpose together. So being open to that and talking about diversity and talking about the workforce, knowing that we can all join in this effort, even if we're not Hispanic or Latinos, but we can be, from a cultural, humble perspective, we can be curious, we can be open to hearing about what it means to be part of that recovery process. So thank you. Moving on to our next question. Thinking about equitable access to the multiple pathways of recovery. So we know there are huge disparities, very big disparities in access to multiple pathways of recovery, particularly among Latina populations who are in substance use treatment. When we just think about treatment, I think there's a staggering number of almost 90% of Hispanic Latinos with a substance use disorder who are not being treated. So how do peer recovery models help bridge this gap?
An important question. I'll take this one on first, and then my colleagues will jump in as we move forward. There's some baseline here that I think is important to establish first and foremost. So that baseline is as follows. The majority of money that we spend on issues of substance use as well as mental health, we spend it on treatment. And it's important to spend money on treatment. I'm a proponent of treatment. I'm a beneficiary of treatment, and I believe in treatment, and treatment works. Here's what research says. Not everybody who needs help needs treatment. So that is an important anchor here in this conversation. About of all people with a substance use condition, about 25% of them need treatment. The other portion can and do get better utilizing the multiple pathways of recovery, right? So it's important to anchor that. Do we have enough treatment? No, we don't. Do we need more? Yes, we do. And then the other anchor here is that our system of care has been designed to meet the needs primarily of white, heterosexual, affluent males, which means that if you're not from that community, chances are you're going to experience a lot of difficulty with access and then with quality of care. And those two things are two separate issues, right? I have health insurance. I can gain access to a doctor. That doesn't mean that they're going to treat me nicely, right? Because there's such a thing as institutionalized racism in this field and in the work that we do. So that's number one. So the other thing that we need to, there are many things, but the other thing that we need to, that I want to highlight here is, okay, so what are those other multiple pathways of recovery? And so peers have been trained to understand that there's no such thing as one way of doing things. Early on in my career, I thought that because I went to a TC, Casa Don Pedro Luis Ocampo, and my first job out the rip was to help people get into treatment, I thought everybody needed residential treatment and they all needed what? Because if it worked for me, it worked for everybody else. And one of the things that I found out quickly is that that is a fallacy, that is a lie, that comes with very good intentions. But what we need to do is to put options in front of people. This is about choice, self-determination, options, and agency. In agency here, I mean the ability to express what I want for me and not for you to tell me what I need to do. Because our field has been really punitive, telling people what to do, when to do it, how to do it. And then when it doesn't work, we blame the person in front of us, right? So what are some of those pathways? So we're talking 12-step fellowships, right? Do they work? Of course they work. Are they for everybody? That's 12-step. We're talking about NA, GA, AA, all of that stuff. There are many across the world, not just in this country. So do they work? Of course they work. Are they for everybody? No. We have holistic approaches, yoga, meditation, acupuncture. Do those work? Of course they work. Are they for everybody? No. Exercise and recovery, does that work? Of course it works. Is it for everybody? No. Smart recovery, rational recovery, celebrate recovery. Do those pathways work? Of course they work. Are they for everybody? No. Sobriety and recovery, formal treatment, residential, outpatient. Do those things work? Of course they work. Are they for everybody? No. There is something that we are paying more attention to, even the country's 30 years behind, that's harm reduction and recovery. Does harm reduction work? Of course it works. And I will ask that second question. Is it for everybody? You might be saying no, and I would disagree with you there, because harm reduction is for everybody. I no longer use substances, but I use harm reduction on a daily basis. You see? Dead people don't recover. People, we want to have them be safe until the point where they're ready to enter into recovery processes. So I don't want them to get infected with HIV or hepatitis C. That's why I believe in syringe access, right? I don't use substances to brush my teeth. I look I don't have people who sell unless I am doing work in this field. I don't do a whole bunch of things, but I do a whole bunch of things that are harm reduction related, right? So just gave you just a select few of some of the multiple pathways of recovery. So what is our role as peers? What is your role as people who want to help serve? Think about this weekend or this week, you're probably going to go into a restaurant. When you go into that restaurant, they sit you down, they offer you something to drink, and they bring out this revolutionary thing called the menu. They don't tell you you're having hot dogs whether you like it or not. They actually, right, provide options. And if you like it, you will have more of it. And if you like it, you will tell other people. And if you don't like it, you go elsewhere. So our role is to do that, to provide options in front of people and let them select what's best for them. And some people don't even identify with the term recovery. Some people just say, God lifted the obsession from me to use. I have been delivered. I no longer, and I really don't care how people identify. The thing that I care about is, what are you doing to get better and how can I help you? That is the mantra. Not for you to talk like me or, spit back whatever I say about recovery. Is what are you doing to get better? What do you want to do to get better? And that's what we should do. And then finally, I'll say this. If we're looking for broken people, that's what we're going to find. I don't work with broken people. I don't see broken people. I see everybody with the ability to get better. And I look for strength, resiliency. I look for things that are positive within human beings. When we emphasize the positive, when we're strength-based, people are attracted to that. If we are people who reflect, you're broken and I'm here to save your life and I'm here to fix you, that hasn't worked. We need to do away with that, right? So I couch my remarks in that.
Thank you very much for bringing that. And it sounds, from what I'm getting from the gist of it, those models cannot be imposed, cannot be with a rhetoric which try to assimilate in a forceful way, but open up possibilities and pathways and experiences. So thank you for putting that into important context. Moving on to our next question. Now we're thinking more in terms of capacity building, policy, and program development a bit more at the level, right? So think of this, maybe we can ask ourselves, what are some key policy changes or organizational practices that could enhance the integration of peer recovery support within settings of service for Hispanic and Latino individuals?
I think I'm leading off on this as well, and sorry for going long in the previous one, but let me do a better job of monitoring my own time here. So what are some key policy changes or organizational practices that could enhance the integration of peer? So, when we think of many spaces and places have policies and procedures that are designed for clinical settings, that those policies around clinical settings are appropriate for key people who provide clinical services. They don't work for people who identify as peers or for hiring peers. They just don't work. The main role of a peer is to use their lived experiences to help people identify barriers to recovery and then help those very people reduce those barriers while developing recovery capital. And part of that mantra is to use their lived experiences in doing that. So looking at policies is first and foremost, where do people meet with folks who are in need of services? And if your agency says, no, they must come here and make an appointment, that doesn't really work well with peer recovery services, because substance use disorders happen in community. Recovery happens in community. Not what William White says about this is that recovery can be initiated in treatment, but recovery actually happens in community. And so what does that look like? That peer folk are in the community delivering services where people live, where people play, where people die, where people, right, in community. And so agencies need to be able to understand that flexibility by way of policies that support peer workers. The other piece is allow peer workers to share small snippets of their story without thinking that that's a violation of boundaries, right? So the definition of boundaries look very different right, by way of policies and practices within organizations for the peer workforce. And it's not to pin the clinical workforce against the peer workforce. It is to actually better understand our roles and to integrate the two, because there's power in the two. I know plenty of peers who drive their own car and they take people in their car to certain places, and not just to appointments, right? But to social events, to activities and that sort of thing. That is a move far away from what clinical people are allowed to do or not to do, right? So I'm thinking about what these policies are that look different from those other policies that help the integration of this, right? The other huge piece that we've talked about here multiple times is language. Cuando yo cambio el español, when any one of us here who knows Spanish, we change to Spanish, or anyone changes to a language that's not theirs, some people get bent out of shape with that within organizations. So it needs to be addressed by way of policy. We hired you because you are bilingual, multilingual, because you speak another language. And so if that's a value, the organization needs to compensate people for that, first and foremost, and allow for that to happen in organic ways, and not to jump in and say, well, you can't speak that language here because, you know, some of our people feel uncomfortable. Those are policy questions within organizations, right? And practices that help you to do what? To recruit and retain Hispanic, Latino, Latina folk into your agency, and to retain them. Because we vote with our feet. If you hire me and you're not paying me for my skill set, and then you're not allowing me to express myself within the culture that you said is important to deliver services, and then you have other policies that run against that, then I'm going to vote with my feet. I'm not going to stay regardless of how much you're paying, because this is not about, for many of us, it's not about the pay. It is about the work that we do and what we get out of that. Let me stop there to allow for my colleagues to respond and add to that as well.
Well, I can say something. Janer say so much, an important thing, right? About changing policy. How policy looked the last 50 years, in addiction treatment in public health. The disparities, the big disparities, health disparity is a policy failure. We can talk, all day, we can advocate all day, but if we don't change policy and legislation and change the integration of our organization, we're not doing nothing. And it's important for that we understand, like, for example, in a place like Miami, from Palm Beach to Miami is 2 million people. And that is not like 2 treatments with all levels of care, or 2 RCOs that have training in services in Spanish. And then when that RCO is taking millions of dollars, right, and you're leaving out 80% of the population, we have to change policy there. It's like insane. And we talk about cultural competence, and the lack of cultural competence is a form of incompetence, right? And it's really important, be passionate, talk about, disparities. And the solution is that we have to understand that we have to adapt to this system that we call the new movement of recovery, because everything that we're talking now about multiple pathways, about everything, it's been the last 15 years, Back in the 90s, back in the 80s, we didn't have that. We have mass incarceration. You're going to go to jail for 20 years if you get going down. So and who suffer in the 80s? Black and brown people, right? We're not going to go that deep. What the meaning of the drug war was in the last 50 years, and what happened in 2005 when the LP epidemic came. When the LP epidemic came and affected white people, everything changed. And we have to understand the history, and we have to understand all that, and all this politics that's changing, but we have to include that, cultural elements in public health. Thank you so much.
Thank you, Carolina, I see you have your hand raised as well.
Yes, I won't take too long. Thank you, Janer, and thank you, Angelo. I feel that, at the federal level, policies should require cultural competence and language training for all peer support specialists and healthcare providers receiving federal funding, focused on cultural humility. I think that that's something that could be done. The language accessibility, where there's federal and state mandates ensuring that peer recovery support services must offer services in both English and Spanish. Anybody receiving federal or state funding for recovery services should be required to have the availability of translated materials, bilingual staff, language interpretation services, like that should just be mandatory. Also, I think family-centered approaches, right? Being able to, our Hispanic and our Latina community places a high value on family unity and involvement. So if there was federal and state policies that could provide funding for family inclusive services and peer recovery programs, I think that would be beneficial. Organizational policy should encourage active family participation and be using some of those funds in regards to that, because that's such a central role in the family with our community. And trauma-informed care with cultural sensitivity as well, that be integrated into federal policies, state policies, that it should be a mandate, for peer recovery support services.
Thank you. Thank you all for those both background and history of where policy was lacking and where it should go in a certain sense. And I think those aspects within trauma-informed care, knowing that care can be individualized, but we need to think about families and communities and how they work together, right, in conjunction. Yes.
Eric, before we move to the next question, I would be remiss if I don't uplift this piece that Angelo just alluded to, right? Most peers, most people with lived in living experience, people who identify in recovery have been touched by the criminal justice system in the US, which means that we have a criminal offender record. And when we talk about policies and procedures and changes at organizational level, is that organizations have a responsibility to think about who they hire in ethical ways. Our workforce is in crisis. There are people with lived and living experiences who want to contribute to this field, yet they're denied access because they have that criminal offender record. And I can tell you that some of the best people that I've hired and worked with over my lifetime are people with those very criminal offender records. And so we need to do a lot to change policy at the federal level, at the state level, at the local level, but also to change policy at the organizational level so that these folk can have entryway into the field and make contributions that are extremely important. So I wanted to uplift that because that is a social justice issue, it's an equity issue, and it is an issue of how we deal with people with criminal offender records.
Thank you. Thank you again for contextualizing that with critical importance in terms of power dynamics and how some people end up as marginalized and not being able to be part of that, as you mentioned, workforce space, which can help contribute so much to. And I think that brings us to the point of future directions, right? Where do we go? So thinking of future direction, what are your hopes for the future of peer recovery in Hispanic and Latina communities? What should we be focused on next?
Can start. I have to say that thank you, for opening this conversation. I think this is a start for the future. When we talk about our issues, and a platform like this, and we have people like Hannah, Carolina, and Glory with all experience, right? And the representation is everything. And peer support, and for that we need more training, more peer. We need to question every state and everywhere we went. We need to question why we don't have the peer support or in Spanish. I'm not talking only about Spanish, but when Hanel was talking about understanding your community, when you're working with an RCO or all the recovery organization, all the agency, and you're in a community, you have to understand your community. You know, like who's your community, and bring that community the tools for healing. And then I think we need to do that, more training, you know, in that language. It can be Spanish, Portuguese, or whatever language, but we need, the future is, you know, continue the conversation. You know, we have to continue talking, fighting, and doing the advocacy. The great work that Carolina is doing, the huge work that Hannah is doing, national and international, and understand. And I'm going to say it again. We dealing with something that got like 200 years, right? Like stigma and all those barriers, you know. And we only have like the last 20 years we've been making changes, right? And those changes we have to put, you know, tenemos que traer la situación de nosotros y traerle, tú sabes, que la persona vive una vida digna, no importando, tú sabes, que haya usado droga, que use droga. It's really important that we focus and understand that stigma is the number one barrier. You know, I was talking to somebody yesterday, you know, a very intelligent guy, and he was telling me that it was inconceivable to him that this guy continued to use. And I was like, he got mental health issues. You have to educate more in this issue. But so the lack of education contributes to stigma. Thank you so much.
Thank you, Andrew. Carolina, I see your hand raised, please.
Yes, thank you. So one of my biggest hopes is that we could finally eradicate the deep-rooted stigma around mental health and substance use within our Hispanic and Latina families. And that means like shifting the narrative, right? From shame to one of hope and recovery. And having spaces like this that are opening these doors, being able to have, like Angelo said, you know, training for our community, bridging that gap with the language barrier, it being, you know, raising up leaders, a generation of community leaders that are in recovery, that have experienced recovery firsthand. You know, my son sees me as a woman in recovery, and that he can now guide others with compassion with this, and that leaders will advocate for the change. We have our young generation that is really coming forward full force, right? So training and leadership development so that the peer recovery champions can be the voice of change, as well as, you know, those that have been here for many years doing this work, and those that come after us will continue to do this, advocating for bilingual certifications. Again, that is something that is just part of legislation and all things, anything that improves community, that the language is also there in Espanol for us. That's what I'd like to see.
Thank you, Carolina.
I want to say that increased accessibility, right? I want to see a greater access to peer recovery services that are culturally and linguistically tailored, right? Incorporating peer support roles, right? We need to define those lines, right? In my organization here, we have case managers, clinicians, and peer recovery coaches. But these lines are defined, right? Where we're not crossing over anybody to provide these services. So it's more of education on what is a peer recovery coach and what is their role. Definitely, like everybody else has said, cultural competency training. But I want to include youth engagement, right? We need to reach our youth. You know, we need to help them not fall in the same patterns that we did. You know, so how do we educate them? Definitely expanding funding and resources. And most of all, celebrating success stories, right? We gather here at least once every 3 months and just celebrate the success stories of our groups, right? Where we're able to share, you know what, this has helped me along the way. How can I share this with other community members as well?
I'll add my 2 cents to this piece here. I look forward to the time in this country and elsewhere where we lead with a true public health model and not a criminal justice approach to public health problems. SAMHSA has currently estimated that we need approximately 100,000 people in our workforce to begin to meet the needs of people. That's to begin to meet the needs of people. My question is, what percentage of that should be representatives of the Hispanic, Latino, Latina community. And that is not going to happen because other people decide that for us. We need an army of advocates that can advocate and continue to advocate on our behalf. And everything that has been said here can be put under that advocacy umbrella, right? So an army of well-trained, well-spoken advocates that can advocate on our behalf. Because if not, we're going to continue to be an afterthought. We're going to continue to, oh, here, adapt and tailor this, as opposed to we lead with our strength. Our community is the largest so-called minority in the US, and that comes with a lot of power and strength. And we need to harness that strength for the better. When it comes to peers, and we need career ladders for our peers, not just to come in and do frontline work, but some of them can and will be supervisors, directors of programs, executive directors, like the folks that are on this panel, right? Someone gave us an opportunity and we came in and didn't sit there, but there were mentors who brought us along. There's something that we can all do in this space is to be good mentors to other people, to not be gatekeepers for keeping people out, but to open doors for people and allow people to get in. There's way too many people who get into their positions, they're comfortable, and then they're threatened by people. I know many people who can do my job better than I can, and I'm not threatened by that. I am, me siento orgulloso. I feel proud that we have these folks who are able to do that. Those folks in our field deserve adequate, ongoing, and quality supervision if we're to do this work. We need to emphasize wellness and emphasize not self-care from the perspective of go do your nails and your hair and get a massage. That stuff is important, and I support that, but we need to pay people well. We need to provide benefits, 401k plans. Organizations need to be held accountable as opposed to telling people, go do your nails and you're going to feel better. I love doing my nails, but that is not going to put money into my pocket. That takes money out of my pocket, right? And so, those sorts of things we can do. And then finally, I'll say this. We need to focus on the structural determinants of health. I know that many of you care for children and young people in our society, in our community. Do you want them to have a bed for treatment when they develop a problem, or you want them to never need a bed? And if we address the structural determinants of health, that is working on prevention. And many of us don't see ourselves as working in prevention, right? We do a lot of work to pull people out of the rivers of substance use disorders, mental health, and all of those structural determinants, right? We're pulling some people out of those rivers, but we can't get to everybody because our system is not built that way. There's a really important quote by Desmond Tutu who said, at some point, we need to just stop pulling people out of the river. We need to go upstream and figure out why they're falling in to begin with. And that's prevention, right? And we need to care for our folks in the collective. And I know that we do. That's part of our cultural strength. We think about the collective first. So it's for me, it's all of that and then some. And I'm sure that many of you, you've been putting stuff in the chat that I've been reading, going like, oh, wow, this is like really great stuff in terms of recommendations, all of that. And I know that why you're here. We know why you're here. We know you're here because you're committed to working in collaboration with others to make life better for other folks.
Thank you so much all for really illuminating the conversation with your responses and your insights. And I think as now taking this opportunity, open it up to audience members so they can bring their questions. And I hope this has been a space, as we've been talking about future directions and culturally responsive care, a place of support between ourselves and for those who are joining us today. So I would encourage everyone, there's a lot of comments and opinions in the chat. If you have direct questions to our panelists, it's easier for us to filter that through the Q&A tab, if you can use that. If not, we'll try to figure it out through the general chat box. So please share with us any thoughts, opinions, or questions for our panelists. So we'll start Yes.
Eric, there's a question that came in early, so I'll read that one. Which initiatives have there been for individuals that are diagnosed with a disease such as cancer and are also facing addiction? The best way for me to respond to that, others can chime in, but I can say this. We now have peers embedded in criminal justice settings, in treatment settings, but also in primary care, in community health, federally qualified health centers, in hospitals, in emergency departments, all of that. So those people who are working in those settings, they get to see people with co-occurring things, because this is what your gets to, right? Many of our people have substance use and a mental health condition. They have other co-occurring health conditions happening, right? And what the data, what the outcomes show is that when we have peers embedded in those settings, the outcomes for those people become better, because now you have people who really understand folks, from the cultural elements to the disease of addiction to challenges with mental health, but also other health conditions that are important. So I wanted to respond to that one, at least off the rip, before we get other questions in the chat.
Thank you. Thank you for bringing that. And so we are getting some questions in the chat. I think I'm going to move on to the next one. And I think Carolina answered part of this through the chat, but I want to open it up to the conversation. How do you begin to reach out to Latino community in an environment where Spanish recovery services is just starting? It's just initiating. How do we begin in those settings?
So I put that, I'll just elaborate on that, put that in the chat, right? There's trusted community leaders in that area, in the neighborhood, mainly church leaders, influencers, local organizations that are working with the community. And people know who everybody is in the community. They know who to go to. Who's that woman, like Janet was saying, the women are strong pillars that people go to for support, or through the church, that doesn't have a bunch of formal training, but it's just the person that everybody goes to for help, and connecting with those organizations, cultural organizations, I think is a place to start. There's so much more to do, but that's what I'll bring into that.
Thank you. Thank you, Carolina. We also have a question here for one of our audience members from the Virgin Islands. What types of peer support services are rendered to incarcerated individuals?
Another huge aspect that we didn't touch upon, but thank you for the question. I said that we have peers embedded in criminal justice settings. And so right now I can tell you that our neighboring state here in Connecticut, through the Connecticut Community for Addiction Recovery, they're training peers behind the wall to be peers when they come out. And so that's happening in many other parts of the country as well. So folks are identified who are going to come out within the next few months. They're trained behind the wall, and then they are placed at a place of employment when they come out, either doing volunteer or paid work. And that way they are in a better position to facilitate that reentry process for people behind the wall. There are even peers who have been trained behind the wall who are never coming out because they're lifers. They're doing a lot of time, right? But that doesn't mean that they're not interested or in recovery. I've met plenty of people who are behind the wall doing a lot of time, and they identify as being in recovery and they want to give back. One of the important things to know there is that you need to be able to develop a relationship with that institution, and you need to be able to provide a program that makes sense, a collaboration that makes sense, because many of these programs are a partnership between a jail or a prison and a community-based organization. And so once you develop that relationship and establish a partnership, obviously you need to have the funding to be able to do it. But guess what? Prison ministries for people from the faith-based work, that has been happening for decades, right? And so that has always included peers in that sense. So there's a lot of work happening in that space. We can do more of it as it relates specifically to the Hispanic, Latino, Latin population.
Yeah. Thank you, Hannah. I'll jump in on this one. In California, from my understanding, it depends on where the person is incarcerated. If it is in a county facility in our county specifically, we do not currently have community-based organizations offering peer recovery support services. I think our behavioral health will probably be the first one to be able to do that in there, just because of the way that the county is set up. But in the prison system, for example, just through our organization, is our recovery coaches write letters. So the word gets around really quickly within the carceral system of what organizations are out there supporting, as well as they have, tablets now able to engage and make phone calls, and we offer peer support over the phone. And then most recently was the first graduate class at Valley State Prison, which is one of the male prisons, where there was peer support certification that was trained to a cohort in there, and there was a graduating class from people within, and then also in the women's prison was the first. So it is just getting underway. But they've had that peer mentorship role within the carceral system. It just hasn't been, called peer certification. So now it's creating a workforce for people to come out and have something to really go into when they come home.
So a colleague of mine just sent me a piece of information. She's on the webinar as well, and I do a lot of work with Estela Besosa from the ORN, the Opioid Response Network, and she's been working with the U.S. Virgin Islands and others, and they the jail in the U.S. Virgin Islands just canceled a training that would focus on the very issues that we're talking about here. Again, we need an army of advocates to uplift voices and say, this is what we need, because it's not enough for one or two people to be saying it. We need a lot more people saying these things to continue to put pressure on the powers that be, that it makes no sense to continue to lead with a criminal injustice approach to these public health matters.
Thank you all very much. So we're bringing there and thoughts about a lot of resources and reshaping the ideas of what we want care to become, so it's accessible and it resonates with our Hispanic and Latino communities. In the meantime, as any other questions comes up, I will let the audience members know that we shared our evaluation link for today. So it's we really appreciate for you to give us your feedback, your opinions as to other trainings and other offerings, webinars that you might like to see from our center. So please let us know. Our link is through the chat. So I'm seeing a lot of amazing and great comments here. Thank you, Rebecca. This has been a great presentation. You are embarking on new peer support specific to our Latino community. Muchas gracias. Thank you very much. I have another question here, which reads, are there any resources for collegiate recovery centers in Spanish? I hope I pronounced that right. Colegiados, I guess I'm guessing that means collegiate recovery centers in Spanish. Any resources?
Eric, this is an important opportunity to mention that SAMHSA is about to announce the winner of the National Peer Recovery Center of Excellence Center, and the university that had that contract developed a bunch of tools that include tools in Spanish and in English. And some of those tools were developed in the Spanish language, and there were some questions about where those tools exist. I would encourage you to look at their repository of resources within the National Center. Look forward to who's announced as the next organization that is going to take on those services. And there's a huge commitment, because I just spoke to the person today, there's a huge commitment to continue to provide peer recovery support, technical assistance, and training to all of the states, but there's a huge emphasis in the application on Hawaii, Guam, the U.S. Virgin Islands, Puerto Rico, and other territories. So please look into those resources because they're there. We'll continue to make you aware of those as well.
Yes, thank you. And the Peer Recovery Center of Excellence has been a great partner of us, to us, and we hope they continue with their great work. So there are resources there for you as well. Carolina.
Hey, I did want to mention something. There has been other organizations that have provided nationally training for our Hispanic, Latinx, Latina community in Espanol, right? And what I continue to see is the reach of our community, like nationally, of like bringing people together to these important trainings, topics, ideas, technical assistance, that the participation is low. And I always question like where we reach our folks at a national level, like how do you get that out there, with partners, the social media, the WhatsApp. Can we do a big WhatsApp broadcast? Things like that reach out to certain Spanish-speaking communities. I think that that's been a thing that we've experienced when you go on a larger scale of like, how do you collectively reach everybody? So places and spaces like this, getting on this mailing list, being able to share the resources, I think is very important. So I appreciate the work that you're doing, and thank you for having me be a part of this.
Thank you. We feel very fortunate to have all of you. And I see in the chat there that one of our colleagues, Shannon Roberts from the Peer Recovery Center of Excellence, shared the link to their website. So we encourage you to check that website as well. There's a wealth of resources and ways to connect with others. This is one of those spaces, and there are many others that we can collectively hope to promote. So I'm looking at the time and at the chat. I'm seeing a lot of thank you. So thank you as well. You are many who are here from many different places and spaces in the nation are working, I know, with with a strong commitment to equity, with a strong commitment to help our Hispanic Latina community. So thank you so much for your work.
To that collegiate question, Eric, at the National Center of Excellence around the peer piece that Shannon just put, shout out to Shannon. There are resources and information about collegiate recovery there. Almost on every single topic that has to do with peers and recovery is there. Do I know of any standalone collegiate programs for recovery that are run by, for, and with the Latino community? Not to my knowledge, but it would be nice if anyone knows, please put it into the chat, because it's an important resource that we would like to share with other folks.
Thank you, everyone. It's I don't see any more questions that are being addressed at this time, but we are very fortunate to have your voices, your experiences, your thoughts, and great insights into policy changes, how we tailor community services, how we tailor care within this peer recovery models and peer support roles. So thank you again, and we hope to be connecting again soon in a space such as this with you.
Muchas gracias y buenas tardes.
Muchas gracias. Thank you, everyone.